Hello again, everyone. This is Jim Henry. This is Tinnitus 101, the basics for everyone. We just completed part 1, and now we are on part 2 of 5. The effects of tinnitus. We first need to distinguish between the sensation of tinnitus and effects of tinnitus. The sensation is the sound itself. If a person says, I have tinnitus, we don't know if they mean I just have the sound and no effects, or do they mean I have the sound and effects? So it's critical to know if a person is bothered by tinnitus, and if so, this would be the reason. Different effects on a person's life. No cure for the sound, but the effects of tinnitus are very treatable. And we'll talk about different methods of treatment in an upcoming presentation. There's bothersome and there's non-bothersome tinnitus according to the AAO-HNSF. And that's mainly for clinical purposes. We want to know if a person's tinnitus is so bothersome that they might benefit from treatment. If it's not bothersome, they generally don't need treatment. That's the main difference. But bothersome tinnitus can be on a continuum from 0 to 10. And I would rank mine a 1. I'm slightly annoyed by it. I wish I didn't have it. I wish there was a cure for it. But I've habituated to it, and so I'm not particularly bothered by it. I'm a 1. Some people are a 10, and I talk to those people all the time, and they're extremely bothered by their tinnitus. They really need help, and that may be one of you that's listening to this right now. There's different reasons why tinnitus can be bothersome to a person, and we're going to go through these reasons. It's not all-inclusive, but it's a pretty good indication of why tinnitus is bothersome for some people and not others. And one reason is the circumstances during the onset of tinnitus. What was happening when the tinnitus started? And it's often a traumatic injury, a traumatic experience. Sometimes it's just high stress that brought it on. And so thinking about the tinnitus makes a person remember that stressful event. So if it was a car accident, then their tinnitus is a reminder of their car accident. Or again, any trauma. So we can have sudden onset tinnitus, which tends to be more bothersome than gradual onset tinnitus. So people who work in a factory or musicians, they have constant noise exposure, maybe construction people. And so their tinnitus comes on little by little by little, and then they know they've got it. But it wasn't a sudden onset. They tend to be less bothered by their tinnitus, but that doesn't mean they're not bothered by their tinnitus. People have different personality traits, and some people have listed hundreds of different personality traits. Most people like to use the Big Five, which makes it a lot simpler. These are the main personality traits of most people. So people can be more or less agreeable. They can be more or less conscientious. They can be more extroverted versus introverted. They can have emotions that swing from very emotional to not emotional, or they're just emotional in general. And then people are more or less open-minded. They've done studies, and they've looked at people who are bothered by their tinnitus, and they've generally come to the conclusion that people with bothersome tinnitus are more likely to be less agreeable, more anxious and depressed, and more introverted. Now that doesn't apply to everybody, but that's what studies have shown. Also, people who are more detail-oriented, like engineers, tend to focus on their tinnitus and analyze it. And what does it sound like? And they think about it. And the more you think about it, the more you react to it. So personality can have a lot to do with whether a person is more or less bothered by their tinnitus. And then the sound itself. the loudness, the pitch, the complexity, the number of sounds, the location of the perception. These are the psychoacoustic aspects of the sensation of the tinnitus. And we can't say for sure, but it would seem that the louder the tinnitus, the more a person is bothered by their tinnitus. But that's not necessarily true. People can have very mild, soft tinnitus and be extremely bothered. Some people have loud tinnitus and they don't even think about it most of the time. So we don't know for sure, but we know that these characteristics of tinnitus could be a reason why people become more bothered by their tinnitus. Then the daily lifestyle. How does a person live their life? People who are generally busier tend to think less about their tinnitus. People who are not so busy tend to think more about their tinnitus. For example, people when they retire, some people when they retire, suddenly they're not busy anymore, and they are more aware of their tinnitus. And by being less busy, they're more aware of their tinnitus, and their tinnitus becomes more of a problem. That's just an example. But in general, people who are busier, they have a busy lifestyle, tend to think about their tinnitus less, tend to be less bothered by their tinnitus. And then the acoustic environment. So the acoustic environment can have positive effects on tinnitus and can have negative effects on tinnitus. So we're going to talk about sound therapy and how sound therapy can be helpful for tinnitus, but also there can be negative effects of sound because sound can increase stress, it can reduce quality of life, and it can exacerbate reactions to tinnitus. And we talked about reactive tinnitus, so exposure to certain sounds that are below a hazardous level can make the tinnitus louder, more prominent, and that can last till at least the next day. That's reactive tinnitus, a subset of primary tinnitus. Then how tinnitus can be bothersome. There have been many studies to look at different domains or categories of how people are bothered by tinnitus. So one domain is sleep. How does tinnitus affect a person's sleep? That's one domain of how tinnitus can be bothersome. And I was part of the development of the Tinnitus Functional Index. It's a 25-question questionnaire. It took us 4 years to develop the TFI. It was a very rigorous study, and it involved hundreds of patients. Also, we had 17 tinnitus specialists weigh in on what they thought was the most likely reasons why people become bothered by tinnitus. And so, as a result of this study, we came up with 8 domains. And so these are how tinnitus can be bothersome. It can be bothersome by being intrusive. It intrudes on quiet. A lot of people like quiet, and their tinnitus is noisy to them, and it intrudes on their quiet. That's one of the number one reasons why people complain about their tinnitus. They feel like they've lost control, and tinnitus is generally not controllable. We can cover it up. We can have sound in the background. We can do different things so that we don't think about it, but we technically can't control the sound most of the time. It can interfere with our ability to think, concentrate, communicate, sleep. Auditory, that's hearing difficulties that are attributed to tinnitus, and we're going to talk more about that. People often think that tinnitus makes it difficult to hear, and that's usually not the case. But that's one of these 8 domains. And relaxation, if a person wants to relax, they find it difficult to relax because they can't get their mind off of their tinnitus. It reduces overall quality of life, and it obviously can cause anxiety and distress, so it can have emotional effects. So that's it for part 2. Thank you for joining me, and we will hopefully get together for part 3.